Have you or someone you love ever experienced that heart-stopping moment when balance is lost and a fall seems inevitable? That split second where time slows down and you realize there's nothing to grab onto? If you're watching this video, chances are you've either experienced a fall yourself or you're worried about someone who might. I want you to know something important right from the start here, not alone. According to recent statistics, 1 in 4 older adults falls each year, and falls are the leading cause of injury-related hospitalizations among seniors. But here's what many don't realize: falls aren't just a normal part of aging. They're preventable, and that's exactly what we're going to talk about today. Welcome to Wise Elderly Tips, and today's video could literally save your life or the life of someone you love. The strategies I'm about to share have helped thousands of seniors maintain their independence and confidence while dramatically reducing their fall risk. Before we dive in, I want you to know that by the end of this video, you'll have a complete toolkit of practical strategies to maintain your balance, strengthen your body, and create a safer living environment. These aren't complicated medical procedures. They're simple changes and exercises that anyone can implement starting today. If you've ever worried about falling or have experienced a fall yourself, type steady in the comments below. I read every comment and would love to hear your experiences. Now, let's get started with what could be the most important 12 minutes for your safety and independence. Let me tell you about Martha, a vibrant 72-year-old who never thought she was at risk for falls. She was active, independent, and had never experienced balance problems before. But one afternoon, while hurrying to answer the phone, she tripped over an unsecured rug in her hallway. That single moment changed everything: a broken hip, 3 months of painful recovery, and a newfound fear of moving around her own home. What Martha didn't realize, what many of us don't understand, is that as we age, our balance systems naturally decline. It's not just about being clumsy or not paying attention. There are actual physiological changes happening in our bodies that affect our stability. Your visual acuity decreases, making it harder to spot hazards. Your inner ear function changes, affecting your sense of equilibrium. And perhaps most significantly, muscle mass diminishes by about 3% each year after 60, weakening the very muscles that keep you upright and stable. But here's the critical part: understanding these changes doesn't mean accepting falls as inevitable. In fact, one of the biggest misconceptions about fall prevention is that being extremely cautious is enough to keep you safe. The truth? Being too cautious can actually increase your risk, because inactivity leads to muscle weakness and poor balance. So what should you do? Start by identifying your personal risk factors. Do you take medications that might cause dizziness as a side effect? Do you have vision problems that haven't been addressed? Are there chronic conditions affecting your balance? These are conversations worth having with your healthcare provider, who can help create a personalized fall prevention plan. Now, let's move to what might be the most powerful tool in your fall prevention arsenal: physical exercise. After Robert's minor fall last year, his doctor recommended specific balance exercises. Initially skeptical, he thought walking his dog daily was enough. He was amazed when, after just 3 weeks of targeted exercises, he could stand on one foot for 20 seconds, something he couldn't do even in his 50s. What Robert discovered is that balance exercises do something walking alone cannot. They specifically strengthen the core and lower body muscles that keep you steady. Even more fascinating, these exercises actually retrain your brain's balance center, improving your body's ability to correct itself when thrown off kilter. Let me share 4 simple but powerful exercises you can start today. First, the single leg stand. Hold onto a chair for support and lift one foot off the ground. Try to maintain your balance for 10 to 30 seconds before switching feet. If that's too challenging at first, just lift your foot slightly and gradually increase the height as you build strength. Second, practice the heel-to-toe walk. Place the heel of one foot directly in front of the toes of your other foot, as if you're walking on imaginary tightrope. Take 10 to 20 steps this way, using a wall for support if needed. Third, chair squats are excellent for lower body strength. Stand in front of a sturdy chair, feet hip-width apart. Slowly lower yourself as if to sit, but stop just before touching the chair, then rise back up. If needed, you can use your hands for support at first, gradually working toward no-hand squats. Finally, side leg raises. While holding onto a chair or counter, lift one leg straight out to the side and hold briefly before lowering. Repeat 10 to 15 times on each side. These exercises might seem simple, but they're incredibly effective at building the specific balance skills and strength you need to prevent falls. Aim to do them daily. Consistency is key to seeing improvement. While strengthening your body is crucial, your environment plays an equally important role in preventing falls. Let me share Jane's story. Jane never thought her beautiful Persian rugs were dangerous until her neighbor tripped on one during a visit. That night, Jane secured every rug in her home with non-slip backing, a simple fix that could have prevented countless falls. Did you know that environmental hazards contribute to about 50% of falls at home? Your brain processes hundreds of environmental cues to maintain balance, and any obstacle in your path requires additional processing that can be challenging as we age. One common misconception is that good lighting is just about seeing better. In reality, proper lighting helps your brain accurately process spatial information and maintain balance, especially during nighttime bathroom trips when fall risk is particularly high. Start with these high-impact home modifications. Remove or secure loose rugs and cords. These are among the most common trip hazards. Install bright, accessible lighting, especially in stairways and bathrooms. Consider motion sensor lights for nighttime use. Install grab bars in bathrooms and handrails on both sides of stairs. These provide crucial support during moments of instability. Keep frequently used items within easy reach so you're not stretching or using step stools unnecessarily. And consider using contrasting colors on stair edges for better visibility. This simple visual cue can significantly reduce missteps on stairs. Beyond your physical strength and home environment, your overall health management plays a crucial role in fall prevention. When Tom started feeling dizzy occasionally, he ignored it. It wasn't until his doctor reviewed his medications that they discovered the combination of his heart and sleep medications was affecting his balance. Many common medications can affect balance by causing dizziness, blood pressure fluctuations, or drowsiness. Additionally, conditions like cataracts or hearing problems directly impact your body's ability to maintain balance. A common misconception is that wearing comfortable shoes is enough for good balance. In fact, proper footwear needs to provide both support and stability. High heels, backless slippers, and even stocking feet can dramatically increase fall risk. Implement these health management strategies to stay steady on your feet. Review all medications with your doctor annually. Ask specifically about side effects that might affect your balance or increase fall risk. Get regular vision and hearing checks. Even small changes can impact your stability significantly. Wear proper footwear with non-skid soles and good support. Avoid walking in socks or slippers without backs. Stay hydrated and maintain good nutrition. For muscle health, dehydration can cause dizziness, and protein is essential for maintaining muscle mass. Consider vitamin D supplements if recommended by your doctor, as deficiency has been linked to increased fall risk. And don't hesitate to use assistive devices like canes or walkers if prescribed. There's no shame in added security, only wisdom in using tools that keep you safe. Now, let's address something many fall prevention programs overlook: the psychological impact of falls. After her fall, Eleanor became afraid to leave her home. This fear led to isolation, decreased physical activity, and ironically, increased her fall risk due to muscle weakness. Fear of falling creates a dangerous cycle. Anxiety leads to limited activity, which causes muscle weakness and reduces confidence, which further increases fall risk. Breaking this cycle is essential for both physical and mental well-being. Many believe that being extremely cautious prevents falls. However, excessive fear can lead to shuffling gait patterns and tension that actually make you less stable and more likely to fall. Consider these approaches to build confidence. Start with supported exercises in a safe environment, perhaps with a family member nearby. or using a sturdy chair for support. Join a group exercise class designed specifically for seniors. The social aspect can be motivating, and trained instructors understand senior-specific needs. Practice getting up from a fall with supervision, knowing you can recover from a ground position can significantly reduce fear. Use positive self-talk and visualization techniques. Imagine yourself moving confidently through your daily activities. And consider speaking with a professional if fear is limiting your activities. A physical therapist or counselor can provide strategies specific to your situation. I understand that talking about falls can bring up feelings of vulnerability or fear. The thought of losing independence or becoming a burden to loved ones can be overwhelming. These concerns are valid and shared by many. But today, I want you to shift your perspective from fear to empowerment. Every exercise you do, every home modification you make, and every medical check you schedule is not just about preventing falls, it's about claiming your right to move confidently through the world on your own terms. Start small, perhaps with a single leg balance exercise while holding onto your kitchen counter, or by removing that one throw rug you've tripped on before. Each small step builds momentum toward a safer, more confident you. Remember that aging doesn't have to mean falling. Many seniors in their 80s and 90s maintain excellent balance and never experience a serious fall. With the knowledge you now have, you could be one of them, continuing to enjoy independence and the activities you love for many years to come. To summarize what we've covered, understand your personal fall risk factors, practice specific balance exercises daily, create a safer home environment, manage your health and medications, and address the psychological aspects of fall prevention. Which of these 5 areas do you think needs the most attention in your life right now? Or perhaps you have a fall prevention tip that's worked for you. Share in the comments below. Your experience might help someone else in our community avoid a dangerous fall. If you found this information valuable, please subscribe to Wise Elderly Tips, where we're committed to helping you maintain your independence and well-being as you age. Click that subscribe button and the notification bell so you never miss our daily tips that could literally save your life. Thank you for joining me today on this important topic. Remember, falls aren't inevitable, they're preventable. Stay strong, stay balanced, and I'll see you in our next video with more tips for living your wisest, safest, and most fulfilling life in your golden years.